As we commence this auspicious gathering, we would like to invite our esteemed dignitaries to come forward for the lamp lighting to evoke the blessings of Ma Saraswati with floral tribute. Please. Heartfelt gratitude to our esteemed dignitaries for gracing this occasion and lighting the lamp. Now I request the volunteers to escort our dignitaries to the dais. Today, we are privileged to have amongst us an assemblage of distinguished individuals who have excelled in their respective fields and made significant contributions to the realm of healthcare. Your expertise, knowledge, and unwavering commitment to improving the lives of others are truly commendable. To our esteemed chief guest, Dr. T. Dileep Kumar, President, Indian Nursing Council, we extend our heartfelt gratitude for gracing this occasion with his esteemed presence. His notable achievements and visionary leadership have inspired many, and we are honored to have him in this conference. I request our respected Registrar Sir, Dr. Aditya Sharma, to welcome our today's chief guest, Dr. T. Dileep Kumar, with a token of appreciation. Thank you, sir. Now, I take the opportunity of welcoming the custodian and the respected leader within our institution, our distinguished registrar, Dr. Aditya Sharma, sir, who plays a pivotal role in shaping the educational landscape and ensuring excellence in all facets of our academic programs. We welcome you, sir. I also take the privilege of welcoming the head of our academic programs and a distinguished leader in the field of education, our Revered Dean Academics, Dr. Manjula Jain ma'am. Under her guidance, our academic programs have flourished and our students have received a well-rounded education that prepares them for the challenges and opportunities in their respective fields. We welcome you, ma'am. I welcome Dr. Poonam Sharma ma'am, Principal, College of Nursing, who is a beacon of inspiration and a driving force behind the excellence that our College of Nursing stands for. Welcome, ma'am. Next, I welcome Dr. Jasleen M., Vice Principal, College of Nursing, who plays a significant role in shaping the academic and administrative landscape of our institution. Welcome, ma'am. Next, I welcome Dr. Sapna Singh, Organizing Secretary of this conference, who has exceptional dedication and organization skills. Welcome, ma'am. Lastly, I extend a warm welcome to all the delegates and participants who have traveled from far and wide to be part of this conference. Your presence and active engagement demonstrate your shared passion for advancing palliative care nursing and your commitment to delivering compassionate care to those in need. Together, we gather here with a shared purpose to learn, to exchange ideas, and to collaborate in our collective pursuit of excellence in palliative care nursing. May this conference serve as a platform for fruitful discussions, meaningful connections, and transformative insights that will shape the future of our profession. Moving on, I now welcome Dr. Poonam Sharma ma'am, Principal, to deliver the introduction of theme to the National Conference on Palliative Care Nursing. Please, ma'am.
A very good afternoon to one and all, and to our respected chief guest, Dr. T. Dileep Kumar, sir, President of India, and our guest of honor, respected Dr. Alok Kumar, sir, in the absentia, and Dr. Aditya Sharma, sir, Registrar of TMU, Dr. Manjula Jain, ma'am, Dean Academics, TMU, and S.K. Jain, sir, in the absentia, and all the management and all the dignitaries and all the respected guests of resource person and chairpersons from all the states of India. So it's an immense pleasure for me to stand before you today. We gather to share our knowledge, expertise and experience in the field of palliative care nursing. So we are honored to have today our distinguished Chief Guest, Sir, Dr. T. Dileep Kumar, sir. It's fortunate to have you, sir, for today's function. And ladies and gentlemen, please give a huge round of applause for the sir who have uplifted the nursing profession in terms of quality education, service and administration. So I welcome you, sir, once again, and please accept my warm welcome and heartily wishes. And it's an immense pleasure to stand before you. And the main philosophy of palliative care is to affirms the lives and makes dying a normal process. Since morning, various deliberations and sessions we have already attended, and so our theme was basically on palliative care nursing, which is the amending the quality of health in palliative care nursing. So various deliberation and sessions have been carried out since morning, and we have covered the introduction and global aspects of the palliative care, and pain assessment and management of different symptoms, emergencies in different palliative care, and then speech from the hospice center also we have carried out in the morning session, and psychological different aspects, what are the patients they are having when they are having the problem associated with the chronic diseases, how much they are carrying out all the problems and how we have to deal with them effectively. So, and nutritional aspects, spiritual dimensions, and advanced research in the palliative care. As we all know, the main philosophy of palliative care is to neither hasten or not the postpone the death, but we have to provide relief from the symptoms which are caused by the chronic illness and takes a holistic approach to care. So as a nursing professional, we have to integrate all the knowledge pertaining to the theoretical into the practical way, and clinical with the psychological, spiritual support to the patient as well as to the family member. So we can say that primary role is to relieve from suffering and enhancement of the quality of life, of the totality care of the patients who are dealing with this suffering. So only one aspect is not there. We have to take care of all the aspects, whether it is physical, mental, psychosocial, and spiritual elevation is must. So since morning we are talking about so many things, and our Prime Minister Shri Narendra Modi ji also recently launched so many programs related to the palliative care aspect and quality healthcare model. We are implementing the CMC Vellore, and Odisha there is a center and the launch of the palliative care in all the districts. So Ayushman Bharat and so many schemes have been launched recently. So it's a need of our. And my dear student, you are the young nursing professional who are the backbone for the healthcare system. So you have to take care of all your patients in totality. So this was a basically theme of the conference. So this conference have been focused on different aspects, and we have discussed the need of palliative care and upgrading the knowledge of the nursing students, as well as all the eminent speakers have spoken about the different pain symptomatic management, ethical concerns in the palliative care nursing, and showcase about the different psychological aspects, and communication is a major key, and maintaining the IPR and dealing with the patient. And to discuss the advanced directive and end-of-life decision-making ability session is remaining. So I encourage each one of you to grasp and actively involve and engage in the discussions, as you were since morning you were carrying out the different questions you were asking from the different experts. So I also say to you to embrace the spirit of collaboration, recognizing that by working together we can achieve greater heights in palliative care. Once again, I extend my warmest welcome to all of you, and may this conference may be a transformative experience filled with insightful conversations, meaningful connections, and a renewed sense of purpose. So thank you, and I wish you all successful, enriching experience. Jai Hind, Jai Bharat. Thank you.
Thank you, ma'am. It is now time for a moment of significance as we prepare to release the souvenir of this esteemed National Conference on Palliative Care Nursing, accompanied with the book releases. This souvenir symbolizes the collective efforts, knowledge, and achievements that have been shared and celebrated throughout this remarkable event. Within the pages of this souvenir, you will find a treasure trove of wisdom, research findings, innovative practices, and inspiring stories from the world of palliative care nursing. It is a testament to the dedication, compassion, and unwavering commitment of the nurses and healthcare professionals who have devoted their lives to providing comfort and solace to those in need. I kindly request our dignitaries on the dais to come forward and grace with their presence for this special occasion and release the souvenir and the books. Initially, we have the release of the souvenir of this conference.
सर वहीं पे अच्छा आएगा फूल है ना
Moving forward for the book release, I request our renowned academician Dr. Pritpal Singh Matreja sir to come forward on the dais to release the textbook written by him on Textbook of Pharmacology published by the Vision Publishers.
आगे आ जाते हैं मेरे ख्याल से
नहीं सर वहीं पे अच्छी है
ऑथर्स के साथ तो आगे आना
आगे आ जाइए एक
आइए
आगे
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 आइए सर
Detail criticism can
यस
Thank you. Now I request our dignitaries to please behold on the stage. We have one more book release. Book on Cumulative Practicum Logbook for BSc Nursing, which is authored by our principal ma'am, Dr. Poonam Sharma, and our teacher, Dr. Ram Kumar sir, which is published by Arya Publications. Thank you, dignitaries. We are honored to have esteemed dignitaries gracing the dais today who are widely respected for their extensive knowledge and experience in the field of education and their remarkable contributions to have been instrumental in shaping the landscape of our industry. I would now like to invite our distinguished Dean, Academics, Dr. Manjula Jain ma'am, to share a few words with us, imparting her wisdom and insights. Please, ma'am.
Good afternoon, everyone. I take this pleasure in welcoming our very esteemed chief guest for the day, Professor Dr. T. Dileep Kumar sir, President INC, all the invited dignitaries, Registrar TMU Dr. Aditya Sharma, Principal, Nursing College Dr. Poonam Sharma, Vice Principal Dr. Jesleen, all the organizing committee members, the guests from various parts of the country, all the distinguished invitees, paper presenters, and my dear students. It's indeed a moment of pleasure for us that we are hosting the conference on a very, very critical concept and the very important area in the field of nursing, that is palliative care nursing. And I think that when we talk about these kind of very, very critical, very important topics, I think more of the learning in terms of the skills is very important. Because we all understand that whatever we learn in the books, it has to be eventually practiced. And when it comes to life-limiting or life-threatening illnesses, when we know that the destination is sure shot, how we can actually make the journey towards that destination a delight, a pleasure. And for that, a very, very distinctive skill is required, that how to deal with the patient, how to deal with the family members, and how to take up all those requirements which would make the life of the patient actually not a burden, but he can take those moments of life in a most memorable way, so that the family also gets that kind of understanding that we have to now say adieu in a distinctive manner. So when we talk about today's conference theme, I think that we had a good exchange of thoughts in the morning sessions, and I congratulate all those authors who have toiled hard to come up with the release of their books, and they really deserve commendation on this part, because this is also one of the areas of the academician to contribute towards the existing body of knowledge, and keep practicing whatever we learn in our day-to-day practices. I believe that life should not be lengthy, but the breadth also matters, the depth also matters. And this is what this particular conference would address and might have addressed in the morning sessions. See, students, if I say the nursing care, nurses are the heart of the healthcare. And what heart has the role to play in our body? It is known to everyone. So if you are the heart of this healthcare system, you have to have very, very important skill, that is a soft skill. And now this has been made compulsory in your curriculum also. And during a very short period of time, we had a very productive discussions with Dr. Dileep Kumar sir. And he gave so many thoughtful insights on how we can make it more practical, more learning, more experiential, and we at the educators, as the educators and as the facilitators are determined to bring the level of our nursing education at the global frontiers, where we place such kind of standards wherein we become the hub and provide a kind of hub and spoke model in terms of the trainings that we can conduct, and can invite the best of best trainers at our institution to provide state-of-the-art kind of learning to all our learners. And with this, I congratulate once again and wish you all the very best. Have the best and best of the learning moments from these kind of sessions, and we expect more and more of these, because this is just the start, this is just the beginning. More to come, and with this, happy learning to all of you. Thank you.
Thank you, ma'am, for your insights. Now, I invite our Reverend Registrar, Dr. Aditya Sharma, sir, to deliver and share his insightful thoughts with us at this national conference. Please, sir.
Thank you. Our Honorable Chief Guest of today's conference, Professor T. Dileep Kumar, President, Indian Nursing Council. Our Guest of Honor in absentia, Dr. Alok Kumar, Secretary, UP State Medical Faculty, Lucknow. Dean Academics, Professor Manjula Jain. Principal, College of Nursing, Professor Poonam Sharma. Vice Principal, Professor Jesleen, Dr. Sapna. Faculty members and all the delegates, those who have come from various parts of the country for this conference, for this learning. And dear students of TMU and from other institutions. It is very good to see that our College of Nursing has organized this conference on palliative care, which is a very important topic, important theme, and a topic which needs attention, which needs discussion, which needs deliberations, because it's not only about the care which we need to give to the patients suffering with the chronic illness and those who are near to the death. It's not only about giving the care to their family members. The important thing about it is that I was going through a study wherein I've read, I'm not sure how much I'm correct, but I read that on an average 58.6 million people are suffering and they require palliative care, either because they are suffering with cancer or cardiovascular disease or something else, or some other chronic disease. And across the world, and hardly 14% of them gets the palliative care. We need to understand why, after having so much of advancement in technological development in medical field, in the nursing field, in health science and health profession, even despite of all these developments, why we are not able to give care to these patients, those who really require. I think you need to deliberate more upon this. That this might be because of the various policies which the policy makers have not been able to bring because of the lack of awareness about this condition, and the requirement of the palliative care to the patients suffering with these chronic illnesses. It might be because of the large population of the health professions are busy in giving the treatment only, or large population of the people belonging to the health profession are either busy into academics and not directly involved into the practical aspect of it or the clinical aspect of it, or are busy with giving the treatment to the patients with whom they have the expectations that there is a possibility of getting a positive outcome, getting the patient getting recovered, and they don't want to pay attention to the patients, those who do not have this positive prognosis. So it might be because of the psychological thought process which the people have back of their mind. So we need to deliberate on all these aspects, and we need to really understand and need to go through it and need to create the awareness how much care, how much palliative care is required for such patients. So we need to understand this, and I think this conference is going to give a platform to our budding nursing professionals, to our experienced professionals in nursing profession, to other health science professionals, those who are part of this conference, either in presence or in absentia. They all need to think about what kind of awareness is to be brought into the field about the significance of giving the palliative care. We need to really understand, we need to sensitize the health professionals about the conditions through which these patients go through. So I'm sure this conference is going to give a way forward for all the health professions to think about it, to give a thought to it, and come out with something which can improve the level of palliative care which we are giving to the patients suffering with chronic illnesses, and also need to give certain message to the government officials, also those who are the policy makers, to bring certain more laws into it so that it becomes more convenient and easy for health professionals to give the palliative care, so that the restrictions, the legal restrictions which they have, they are able to overcome. Number one. Number two, to give awareness not only to the health professionals but also to the patients suffering with chronic illness and their caretakers, so because large population of our country is unaware of such kind of thing. So we need to care, we need to create the awareness among such population as well. So that is our moral responsibility being into health profession. And so I request you all to take maximum benefit from this conference, and as what Professor Manjula Jain has already mentioned, that we really need to go onto the ground to work upon, only then we can bring the change. So I wish you all the best for this conference. Jai Hind.
Thank you, sir. Moving forward, I now request our today's chief guest, Dr. T. Dileep Kumar, President of Indian Nursing Council, who has been an exemplary leader in the field of nursing and has made significant contributions to the advancement of nursing education and practice in our country. With a wealth of experience and expertise, he has been at the forefront of shaping nursing policies and initiatives, playing a crucial role in elevating the standards of nursing care across India. As the President of the Indian Nursing Council, he has dedication and visionary leadership, has been instrumental in promoting excellence in nursing education, research and practice. His unwavering commitment to the welfare of nurses and the enhancement of healthcare services has earned them widespread admiration and respect. We are truly honored to have him amongst us today, and with immense pleasure, I warmly welcome Dr. T. Dileep Kumar sir to the podium and deliver his enlightening speech.
Good afternoon to all of you. Greetings from the Indian Nursing Council to all the delegates who are attending this very important conference. Respected Alok Kumar ji in absentia from the UP Medical Faculty, Dr. Aditya Sharma with the Registrar of this university, and also Dr. Manjula Jain, Dean of the Teerthanker University, the Principal Dr. Poonam Sharma ji, Vice Principal Dr. Jasleen, and distinguished faculty members of this institution, distinguished guests, distinguished resource persons who have come from the different institutions, distinguished delegates, my dear students and ladies and gentlemen. First of all, I would like to congratulate the College of Nursing of the Teerthanker University for organizing this conference on a very important topic. Very rightly they have chosen, which is a priority, and I think Aditya Sharma ji in his address was mentioning the morbidity and mortality of this whole palliative care. And we realize how important this topic it is estimated, I think he said 58 point something 5 million. I think the data says about 6 million people are required palliative care, and year to year it is increasing. And also it is estimated that less than 3% of India's cancer patients have access to the adequate pain relief. this is a very important piece of data we have. It is estimated that 60% of the people who are dying annually will suffer from prolonged advanced illnesses, which requires our palliative care nursing. I think the problem we know that, I think Aditya Sharma ji was mentioning about the issues about the policy, about the issues of the legal issues, which are very appropriate. Still, the government of India, though they have announced as a national palliative care as a policy, but still it has not percolated in many parts of India. The only best model which has been published by the World Health Organization, including our International Council for Nurses, has recognized and published the services and activities of the modern palliative care model which is being implemented in Kerala. I think the Kerala government has announced as a policy which is being given even at the district level, tertiary institutions, and even at the level of the sub-centers. Home palliative care which is being successfully given by the government of Kerala. I would have been happy if once you are organizing this type of very important topic which is upcoming, which requires a lot of awareness and which need to be pushed to sensitize all the health professionals in different clinical settings, especially in the tertiary institutions, to push this, and also more so our nurses. At least in one way I have to again congratulate this institution. They had, I think, earlier conference, they had an ISPN. ISPN conference they had. And now the ISPN conference, which reads a lot of psychological, psychiatric background of the nursing professionals for taking care of the palliative care also. So the lot of interpersonal relationship, how to develop and how to work with the critical care patients, not only patients, families. Here more so, I think a lot of we have to work with the family members who are in a dire stress. So therefore, at least you are picking up in the right topics to focus for our nursing professionals. And I think I don't know whether you are aware, just in Delhi, our one Dileep NGO is doing a palliative care nursing. I was thinking I will be seeing those people here, but while traveling I was able to reach out to them. They said they are not there, but the message is a lot of NGOs are working in this area. We need to involve the NGOs, and especially at least the DNIP, it is a NGO where we have a lot of nursing professionals in that NGO. Though they are working in the government sector, but doing a voluntary work in that palliative care. Because Indian Nursing Council has recognized them, and we are giving I think 40 webinars they have organized. And for each webinar we give the credit for them to participate. And they also go every Sunday, they conduct a clinic, a free clinic in Mahaveer Vihar. And when they need be, doctors will be there, the nurses will be there. As and when they need the nurses, they will do the home visit and take care of the palliative care. So, a lot of NGOs are working in this area, and I am at least happy to say that even our nursing professionals working in government sector doing a voluntary work, that is to be commendable. It is not an easy task working in a palliative care. We know that how Shanti Avedana, I don't know, you have to take your students to make the visit to the Shanti Avedana in Delhi, which is one of the best nurse-led interventions are going on there. So our students has to visit how they take care of the patients who are in the hospice center, and some of the hospice centers like Bangalore, and of course this palliative care started from Ahmedabad and spread out to the different parts of the country in capital cities. But as I said, though the National Health Mission NHM has made a policy to all the states to focus on the palliative care, but that still that the efforts, the priority which is missing. Many of the oncological institutions, they conduct this palliative care. So therefore I was suggesting to the for the Aditya Sharma that whatever the number of beds you have in this institution in oncology, in those oncology, the nurses who are working in those units should be trained in the palliative care. I don't know whether you are how much this Indian Nursing Council has prioritized this palliative care. Speaks volume that when the case came up in the Supreme Court about the morphine issue of liberalizing the legal issues, at that time Indian Nursing Council was made party of that case, and we were able to show to the Supreme Court how Indian Nursing Council has prepared the post-basic diploma in oncology nursing, and in that we have a very distinctly spelled out palliative care in that syllabus, and also the pain management, which is clearly included in the post-basic diploma of 1 year oncology nursing. So therefore we are ahead. Then I think now Medical Council of India has also started the MD in palliative care. Now it's getting as a specialty. So at least in educational institutions like under the health human resource, we have taken care of in our syllabus and giving more priority to the palliative care. I hope you all know that our latest syllabus of the revised BSc nursing syllabus. Hope you have seen the module. Yes. There is a mandatory module we have prepared for the BSc nursing on palliative care. That itself speaks volume of how in priority the Indian Nursing Council is giving for the palliative care for the nursing professionals. Once we have made it, because we have elective modules also, we have not kept in the elective module. So we have kept it in a mandatory module. So we are very clear that our nursing professionals who are coming from the colleges of nursing, they should be fully prepared to take on the palliative care. And if you see the module, it is very extensive module, but we have put all the teaching learning process in that as a content in that. But ultimately, practically, I think students should visit where some of these palliative care services are being provided to get a more insight and more issues and challenges which our nursing professional has to face while providing the palliative care. So that is the very important piece of message I would like to give to the institution, because until unless if you don't show the actual how the palliative care is being implemented, it's going to be only theoretical, because at least while working in the ministry, I have to get enough comments from the various professionals in the policy making. Your teachers are good in theory but lacking in practicable. This is a very common. Whenever I worked in 30 years in the Nirman Bhuvan, I have to get regulator now. At least we are shifting the gear, how to focus more of a practical and to make competency-based training. That's how we have brought the state-of-the-art National Referral Simulation Center, which has been established in the SGT University, Gurgaon, where I think we have trained about 500 faculty members in the 6 days master training program in the simulation, and many of the 15 to 20 years experienced faculty's remarks is, even if you implement 50% of what they learn from that master training program, the quality will definitely implement. That is the feedback we are getting from the participants. So therefore, the competency-based learning is very essential, and now the patients who are coming to the hospital, they are more having a knowledgeable, even the poorest of the poor patients, when it comes to the hospital, they want a quality of the care. So they don't want for the nursing education institution to prepare our nurses with a competent based curriculum, which we have received very good feedback from the different parts of the policymakers and the different professionals. But very important information, I think I might have shared in some of my talks in different forums. The developed country like Canada, where the University of Brunswick and the regulator of the Brunswick, many a times easily we can get a good remarks by the universities, but to get a positive remark from the regulator is a difficult task, and that too from a developed country. And this University of Brunswick and regulator of the Brunswick has recognized the Manipal College of Nursing, where we have made a exclusively supernumerary candidates of 25 to give a dual degree program to the BSc nurses. So that speaks the volume of our curriculum which Indian Nursing Council has prepared, which is getting a laurels from the developed countries. So that means those 25 candidates who are passing out from the Manipal College of Nursing will be getting a dual degree. So it is because we get a lot of inputs while preparing the curriculum. This is the first time I think because seeing all the electives model and the mandatory module, soft skills, and we are not referring much to the textbooks. We are much referring to the protocols prepared by the Ministry of Health and Family Welfare, National Health Mission, and the non-communicable diseases which the Government of India is prioritizing, and especially this under the non-communicable diseases, this palliative care comes in that context. So therefore, we are able to prepare the graduates with the competencies, but at the same time, there are various issues and challenges our nursing professional face while working in the clinical setting. So that's the reason we are, in order to improve the quality of the patient care, we have come out with the 14 one-year post-basic diploma courses in various specialties. But unfortunately, there are no takers for these post-basic diploma programs. So therefore, we have taken a policy decision that instead of taking the leave to study this post-basic diploma, they should be able to work. While working itself, they will be able to get this post-basic diploma for a career path. We have taken this policy decision and reformatted. We have reformatted all the post-basic diplomas as a residency format. So the residency format, 24/7, they have to be in the clinical setting so that to have the competencies. So that big policy shift the now Indian Nursing Council has made to facilitate, to give importance to our national health policies recommendation of training of the nurses in specialization, we were able to reformat it. Now, I think that's what I was talking to Aditya Sharma ji, at least wherever the oncology patients are there, you should start that post-basic diploma in oncology nursing, automatically the palliative care as a content and also your pain management, all those things are there in the post basic diploma. And 10 or 15 nurses who are working in those units, they should be prepared so that your capacity building of your unit will be there. Then you will be able to get more students from outside, because we need more nurses in a specialty area. Because at present, that is the reason NHB 2017 putting more emphasis on training of nurses in various specialties. So now we are going to the further specialty. I think the nurse practitioner midwives, way back in 2005, the Indian Nursing Council has started as a nurse practitioner midwife. But now the Lancet evidence, which is coming to all the policy makers, that 83% of the maternal and neonatal deaths can be prevented if we have a midwifery-led units who have been trained at the level of the international standard of the ICM in the midwifery. That is the reason the Ministry of Health has come out with a policy decision that they are going to have 84,000 nurse practitioner midwives will be trained and will be having a midwifery-led units. And I was also talking to Aditya Sharmaji, because the Meerut is one of in Uttar Pradesh, having a very good National Midwifery Training Center, which our nurses are practicing the latest the practices, and before the patient is the pregnant mother is referred to the gynecologist, and where the FOGSI, Federation of Obstetrical Gynecological Society of India, where all the gynecologists are members of this professional body, has also accepted this nurse practitioner midwives. So therefore, this is a one step we have gone with going to the specialization. And also we have a nurse practitioner critical care program, which is a 2-year residency MSc level program, which now I think in the Chintan Shivir, where our Honorable Health Minister made a mention that Heal by India, how we should train our nurses from India and to send abroad for the specialization, and also to the other clinical setting level. So now the Planning Commission, Niti Aayog, is given a direction to Indian Nursing Council. These 2 nurse practitioner syllabuses are not enough. Prepare at least 10 to 15. So we are already on board of preparing a 10 nurse practitioner program. 3 are already ready, 7 in the pipeline. Within 2 to 3 months, the 3 nurse practitioners like emergency and trauma, psychiatric nursing, family nurse practitioners, and organ transplant, nurse anesthesia, all these we are in the preparation. And this will give I think now the policy makers have realized how nurse practitioners are able to, in developed countries, making an impact and outcome of the patients in the different clinical setting. So at least now the policy makers are also realized there is a need to train our nurses also at the level of the nurse practitioners. So we have also still gone ahead with, yes, we have now reached the nurse practitioner. There is a legal empowerment which is required for that our nurse practitioners to work effectively in the clinical setting. For that, in the new National Nursing and Midwifery Commission, the scope of practice has been included. Once the scope of practice has been approved with the Parliament, definitely there will not be any problem or bottleneck for the legal empowerment. But the CMC Vellore, which is even without the legal empowerment, they are able to work within the national institutional protocol. They are able to successfully, they can work in the CMC Vellore. So the same model we have prepared to all the nurse practitioners, and even the institution like Mahatma Gandhi Medical College, Mumbai, and the Krishna Institute of Wardha in Karad. So they have successfully the nurse practitioner critical care. Anesthetist, intensivist have telephonically told me, these nurse practitioner critical care who have been trained, they came into handy during this COVID period to maintain and implement and work effectively in their ICUs. So therefore now the lot of visibility we are seeing Let us not wait for the protocols, the legal empowerment to come. Till such time, each institutions will be able to have their own protocols, institutional protocol. In the ambit of the institutional protocol, they will be able to work effectively in the clinical setting. So therefore, there is I think the students who are sitting here, they might be thinking, what is the future of the nursing? And some people might be thinking, why did we get into the nursing? I don't have much of a career path. I think the future of nursing is so bright. If you are all seen the State of the World Nursing Report, SON report, if you have not seen it, please access to our Indian Nursing Council website. You will be able to see the State of the World Nursing Report. In that State of the World Nursing Report, which is where the 2020, to commemorate the 200-year birth anniversary of Florence Nightingale, the ex-NHS, National Health Services of UK, which is the only country where in the globally the expenditure of the health costs are taken by the government. And that type of organization who was happened to be the secretary, who retired from the NHS, realized how important of the nurses and midwives contribution in the healthcare delivery system in UK. So therefore, he took the initiative to the World Health Organization and to the International Council for Nurses, requesting the WHO DG to declare 2020 as the International Year of the Nurse and Midwife, to commemorate the 200-year birth anniversary of the Florence Nightingale. That's how, for the first time, World Health Organization came out with captured the global evidence of the nurses and midwives for the in that book, State of the World Nursing Report. And the main theme of the four themes of that report is, the first theme is investment. I think they are asking all the countries to make an investment for nursing. Number two, creation of the nursing positions. Third is the leadership. The fourth is the service delivery. These are the four themes has been woven in that whole report. And now not only that, just report publication has not been done by the WHO. They have further gone ahead with the World Health Assembly, where 190 countries health secretaries, 190 countries health ministers, and 190 countries secretaries and DGs attends every year in the month of May in Geneva to attend the World Health Assembly to issue the global health issues and trends, and they come out with the resolutions. In such a World Health Assembly, they passed a resolution called Strategic Direction for Nursing and Midwifery 2125, SDNM 2125. You can access that SDNM 2125 and the State of the World Report and the State of the Midwifery Report from the Indian Nursing Council website. I request all the students, fourth-year students and the postgraduate students, you should literally read these the reports. You will be able to get more of a knowledge how the nursing and midwifery in the global scenario and how it can be incorporated into our Indian situation. Your thoughts for the 4-year cycle, and after 4-year cycle means they have given a time for all the countries to implement this resolution of the SDNM 2125, and again this agenda will come to World Health Assembly in 2025. So therefore now for the country, all the countries and also the state governments and the union government, it is for us, for the national and health and professional associations, interest groups, stakeholders, it is up to us how best we can make use of this opportunity. 2020, 2030 is going to be a nursing and midwifery era. If we miss this bus in this decade, we will not be getting this opportunity. So therefore, 2020 and 2030 is a very golden opportunity for the nurses and midwives, for the globally and also for the Indian nursing and midwifery professionals to make use of this opportunity to work with the state governments and also with the government of India to ensure this implementation of these resolutions, and very important these 4 resolutions, because if we go into the detail of these 4 themes, because we are in India, we are facing a problem about the investment. I think this year government of India was able to invest about 1,570 crores for opening of the 157 nursing colleges. At least that investment has come in that perspective. And the National Health Mission has made a policy announcement of training the 84,000 nurse practitioner midwives and opening of the midwifery-led units. That's again an investment which is coming from that. But still, for a country like India, it requires a lot of investment. the very important which we nurses and midwives are facing the issues and challenges with regard to the nurse-patient ratio. In the many of the state governments still have not implemented our SIU norms. In the absence of implementing the SIU norms, staff inspection unit of the Ministry of Finance norms, so you could see in many of the district hospitals, one nurse may be taking care of the 30-40 patients. So therefore, the quality of the patient care in the hospital will not be up to the expectations. So then the leadership, I think this report is telling our nurses are have to work in the clinical unit with a different interprofessional disciplinary people. So if we have effective leadership skills, we will be able to coordinate the patient outcomes, and the impact and outcomes will be more. That's what the evidence is telling. So therefore, there is a need to train our nursing professionals in the leadership skills, and also the service delivery in terms of the working conditions, improving the congenial atmosphere for the nurses and midwives to work effectively. So therefore, it's a big challenge for us in this 2030, and also 2020 and 2030 is also a very significant decade, because the United Nations have declared achieving the Sustainable Development Goals, SDG goals, and in the SDG goals, another important mantra what United Nations is given is achieving the universal health coverage. So in that perspective, the achieving the universal health coverage, WHO DG has said, if no nurses are there, you cannot achieve the universal health coverage. That is his slogan. So therefore, it is very significant, and roles and responsibility of the nurses and midwives in this whole in the ecosystem of the healthcare delivery system. So it is for us our best make you utilize of this, and these type of conferences will create an awareness, sensitize the different professionals, managements, and the other interdisciplinary team to sensitize the latest developments and trends, and making use of this ultimately with the objective of providing the qualitative patient care to the clientele. Because we are so important that I always consider any image of the hospital can be increased or decreased by the way the nurses work in those institutions. Therefore, I call them nurses and midwives are the ambassadors of the hospital. You can still, many people with so many years, the CMC Vellore is there. Why people say that CMC Vellore is best? Because the CMC Vellore best is you will get a best nursing care, and the dual role of the nurses they are practicing. A dean of the CMC Vellore College of Nursing, also in charge of the surgical unit, and after 5 years again she will come back to the so these type of bridging the gap of education and service, which is one of the problem which we are facing in the nursing profession. That's the reason Indian Nursing Council has prepared as a concept note, has put up in the INC website. Now we are encouraging the institution. That's how after the CMC Vellore, now the St. John Medical College Bangalore, with a 3 years persuasion, they will be able to implement that model. So I think the medical colleges like these institutions should practice and implement these models with will be both some of the outcomes which has come in those St. John Medical Colleges, how the patient satisfaction is going to improve, how the quality of the nursing education is going to improve, how the patient cost can be reduced. All these evidences have come out of that study. So it is the Teerthanker Mahaveer institution to take some of these lessons and see how best you can incorporate in your system, and Indian Nursing Council will be willing to support in whatever way to improve the patient care and also the quality of the nursing education and also practice. Thank you very much for inviting me. I think another my request is there for the Teerthanker, which I have already told, which they are all aware. I want to see how soon we can have a state-of-the-art simulation center, what we have established in Delhi in SGT University. I think the management has already assured me that Shortly they are going to have a typical what we have in Gurgaon, they are going to establish in this institution, and this institution should become a leader for the UP area, many of the districts, so that the quality of the education and also the competency based what we have developed the syllabus, that will have a reality if we have the simulation center. Thank you very much.
Yes, sir.
So with your blessings, as the management has already approved, we are going to have this state-of-art simulation facility that's set up, which has been designed by US and the lateral company. We'll be having this setup here very soon in our university, and with this, our university is going to be the pioneer in the state of UP with that facility for our students.
Thank you, sir. We have now reached a moment of appreciation and gratitude as we proceed to the felicitation of our chief guest to express our sincere thanks. For the same, I request our registrar sir and our Dean Academics ma'am to come forward and do the honors. As we draw near to the conclusion of this National Conference on Palliative Care Nursing, it is my privilege to extend a heartfelt request to Dr. Sapna Singh, Organizing Secretary of the conference, to deliver the vote of thanks. Please, ma'am.
A warm good afternoon to all dignitaries on the dais and off the dais. It has been such an honor to be part of this wonderful event. On behalf of Teerthanker Mahaveer College of Nursing, I would like to extend my heartfelt gratitude to our esteemed chief guest, Dr. Dileep Kumar sir, President, Indian Nursing Council, New Delhi. Thank you, sir, for accepting our invitation and for being with us today. Your thoughts have truly inspired us a lot, sir. Thanks to our guest of honor, in his absentia, Dr. Alok Kumar sir, Secretary, UP State Medical Faculty,